Again, now an increasing number of companies are reporting a spike in mental health problems in the workplace. That's because of pressures associated with the COVID-19 pandemic. The South African Society of Psychiatrists has reported mental health is the biggest threat of 2021. Let's chat more about it now with Audrey Katsidzira, a clinical psychologist from U+ Wellness, to give us more insight into this. Audrey, good afternoon, and thanks so much for your time. What are we hearing? What are we hearing? What are we seeing happening with employees at work?
So, first of all, thanks for having me. We are having an increase in cases of anxiety and depression, more mental health issues, mental health concerns. We're also seeing employers starting to really look into their employee wellness programs. So starting to have more sustainable approaches for addressing mental health within the workplace.
So what do we attribute that anxiety, what do we attribute that depression to? What is happening? Are they worried about job security? Are they worried about finances? Is it more a social aspect? What is it?
Looking at the research that I have over the last 12 months, it's really been around the uncertainty that comes from the pandemic. Also just being demoralized, feeling that sense of not having control. Loved ones are passing away, and we also are becoming patients going into hospital and coming out again. So that in itself is a major factor, just that uncertainty. And naturally, as you're saying, that then brings in the question of, do I have job security? So it's not really about job satisfaction anymore, but it's, do I have employment? And then if I do have employment, to what extent do I have satisfaction in this particular place? I think it's also made people start to think more existentially, start to think around, do I have meaning in my life? So yes, the pandemic is here and we understand this now. And now it's what can I do on a sustainable level long term to have some sort of meaning in my life and try to have some sort of agency to deal with the stresses that are there that don't stop just because there's a pandemic.
And you're so right, Audrey, because more and more in my circle, I've been hearing about people going, am I actually in the right job? Is this what it is for me? COVID seems to have brought up a lot of that, especially since they've had time, even though they've been working from home, to reflect and think about, like, how is this fitting? How is my life fitting into this? How is my family fitting into this? So are we seeing a lot of that sort of looking very deep down inside to find their actual purpose and their meaning in life?
Yes, so there's research that's been done in Europe and in the Middle East and very little at the moment in Africa. But you find that there's an increase in people seeking practices that relate to spirituality and contemplation and starting to say, but the pandemic has also brought in a greater need for social bonds, for that connectedness. So I think it now plays into the workplace by a person now saying, but do I really want to be in this environment? And I think coming back to this idea of before the pandemic, people already had life stresses. So now these life stresses are exacerbated. And now let's not forget people that actually have pre-existing psychiatric disorders. It becomes much more difficult to function within the workplace.
And what's the understanding we're actually seeing from employers here now? What are they doing? You say, employers realize that they need to protect their workers, they need to protect them physically, and also very worrying, what we see is things like musculoskeletal conditions that are coming about as well, not just the sort of emotional and mental aspects of it. What are employers doing? What's changing in that sphere?
Well, I'm really happy to know that people are starting to really understand the relationship between the mind and body connection. People are starting to recognize disorders of the mind that, for example, you go to a doctor and they tell you, oh, we've screened you, you're fine physiologically, but there's something going on in your body. Maybe you've got pain, maybe you've got general muscle weakness. And they now say, wait, we need to now consider the psychological dimension of your illness. And now if you consider the context we work in with the post-COVID complications, whether it's post-COVID pneumonia or debility or GBS, you find that people are starting to recognize that they need to be educated about what can potentially come, accompanying anxiety, accompanying depression, post-COVID, as you're saying. So those are some things to consider. I'm seeing employers taking more responsibility to really understand and to really take time to educate their people as well. So there's now a more proactive approach, I think, at this stage. And if there isn't, I think this is now an opportunity to start doing that.
And I think that's especially important because we have now more and more people actually going into the office. Not very many people are working from home as far as I know. I don't know about the overall sort of figures, but as far as more and more people I know seem to be actually going back into their physical workspace. And also that comes with a certain amount of anxiety as well in terms of vulnerability and mortality, doesn't it? And of course we have to look at maybe issues like sick leave and what changes need to be made there now because people are more vulnerable.
Absolutely. And if you consider the timeline when it comes to COVID in particular, if someone gets COVID, so I'm definitely not trying to play into your fearmonger narrative, but someone has COVID, let's say in January, they can start complicating in June. So the timeline needs to be observed. Just because someone had COVID and isolated and took precautions, had a test, got medication, that's not really the end of the story. There's post-COVID fatigue. Right? And then the psychiatric dimension we spoke about, but also just depending on comorbidities, you never know how someone will present later on. And I think employers need to have that sensitivity and also really have that sensitivity, that compassion for humanity that says, okay, we're not in the times that we had pre-COVID. We are now in a different era where we need to now have these considerations that the fact is COVID will affect you in a way that it may not necessarily affect me. So that sensitivity to really say, this is how I experienced it, but this is how you're experiencing it. So I think we need to now be quite open-minded.
And on that comparison as well, Audrey, I would imagine vaccinations come into play in a big way in terms of, whether your colleagues have been vaccinated. People are asking, did you get your vaccination? Some still don't believe in it. They don't believe in a vaccination. They're hearing stories. They're terrified to go out and actually get it. I would imagine that also adds quite a bit of or another layer to that anxiety of actually just being out in the real world again.
Absolutely. And I mean, that remains controversial. I mean, from the science, it's understandable that if you get a vaccination done, you may have COVID or you may have complications, but the idea is that they're not going to be as severe as a person who did not get vaccinated. Because sometimes people argue, oh no, but why should I face if I'm still going to get COVID? The idea is to manage, that unpredictability and to be proactive. And so, yes, it's definitely a personal question, but I really think that we need to do the work. We need to educate ourselves, and maybe that's something employers can also do, to really take time out to educate the people and to really have employee wellness programs that are quite comprehensive, that also center on mental health, because mental health is actually overall health.
Yeah, and it is an ongoing process and a work in progress as we learn more about how to function in this pandemic. Audrey, thank you so much. That's Audrey Katsidzira. She's the clinical psychologist with U+ Wellness.